Supervisor Angie Carpenter. Welcome to Supervisor Spotlight. You know, in our makeshift studio here at Town Hall today, more than 6 feet apart, I think we're probably a good 10 feet apart, we have Dr. Chris Raio, who's head of emergency medicine at Good Samaritan Hospital and Catholic Health Services. And we were joking earlier, I didn't think we'd have Chris back so soon, but we really felt it important to kind of talk about COVID and where we're at. You know, we just came off Thanksgiving, we're approaching the holidays, we're in the middle of Hanukkah. You know, I know there was a wonderful menorah lighting. We did a virtual one here at Town Hall. Rabbi Shimon Stillman of the Chabad of Islip did the lighting, and there was one last night in Brightwaters, and I was so torn about going and not going, and I opted to on the side of caution, and I did not go. I watched it virtually, and it was wonderful. But it's tough with everything going on, you know?
Yeah, I think it's hard for families, particularly this time of year, because everybody wants to get together and, you know, celebrate in their usual way and, you know, carry on the traditions. And but we still need to be a little bit cautious, and people need to keep their guards up, I think, so that we don't get back to a point where we were earlier this year.
And so we saw a little bit of a spike, well, not a little bit, but we did see a spike. Some of the numbers were higher than they were, you know, in the throes of COVID, the pandemic earlier this year. After Halloween, you know, people still out there trick-or-treating, there were parties, the numbers went up, and then Thanksgiving. So we're seeing that spike in numbers. And as I said earlier, we're in the middle of Hanukkah, everybody's starting around preparing for the holidays, you know, other than wearing your mask and washing your hands and using your sanitizer, people have to be careful.
Yeah, I think as much as possible, and I know it's difficult for me and my family, but, you know, we have to try to celebrate in smaller numbers. I'm used to a Christmas Eve where there's probably 70 people there.
Yeah, I know.
Unfortunately, this year that's not going to be happening. The safest thing is always to just celebrate with the people who you live with on a day-to-day basis. I understand that's not going to happen for everyone, and people are going to get together. Keeping ventilation going, keeping windows open as much as possible. Maybe we'll get lucky and it'll be a little warm. Outside is always the best.
Yeah.
You know, keeping away from high-touch areas. The kitchen should be, you know, as few people in there as possible, having one person serve the food, etc. We just have to be as safe as possible. You know, we're seeing numbers creeping up, so we need to sort of nip it in the bud so that we're not at a point where we were earlier.
You know, when you talk about being safe, especially around food, I had someone the other day say they were going to order a 6-foot hero and put it out, you know, kind of as a thank you, and I went, oh, no, I don't think that's a good idea. You know, if you think about it, the hero's laying on the table, people walk up, they go take a piece, no, I'm going to take that piece. You know, that doesn't work anymore.
Yeah, I think, you know, when you're ordering food now, it's everything sort of individually wrapped.
Yeah.
That's unfortunately the way we have to go. There's no more going out and having the big appetizer platters that everybody's dipping into.
You know, we're sitting here in the town boardroom, and this huge table that we sit at, right? And for the last 5 years, at Christmas time, we've had this dessert challenge, and employees make these outrageous desserts, and this table was covered, absolutely covered with all kinds of desserts, and everybody would check off, and they'd be taking a little bit of this and a little bit of that going. And whoever thought, you know, the things that we did in the past that now we would never, ever think about doing.
Yeah, and again, I think some positives will come of this. I think, you know, hygiene and washing hands, etc. I think long term that's going to help with all viruses and even bacterial infections and stuff. That, you know, there'll be some positives to take out of the pandemic.
You know, we had dinner with my grandson and son and daughter-in-law and my husband, and so they go, okay, let's, come to the table, it's time for dinner. And my grandson, who's 7, says to my husband, Grandpa, did you wash your hands?
Right.
So I thought, wow, they've done a good job, in educating him.
Yeah, I think the schools actually have done an amazing job, and I'm most surprised by the fact that most of the kids, they wear the mask. It doesn't, they're not complaining about it. I thought it would be a much bigger deal, even for my own kids, but it seems like the schools have really hammered it home, and it doesn't appear that the schools are a source of major spread from what
No,
we're seeing.
if any of the schools have shown any kinds of outbreaks, it seems to be attributed more to the staff than the students.
Right.
Again, thinking it's okay to celebrate, a momentous occasion like a birthday or whatever. That's not, you just can't do that now.
Yep.
You just can't do that now. I just don't think we can be too safe.
Correct.
In all of this. Certainly there is hope with the vaccine, as we speak, they're being delivered, and, that certainly does give us cause for hope, but it certainly doesn't give us cause to let our guards down.
No, and everybody has to understand that I'm excited about the vaccine. I think it's going to be coming possibly as soon as this week to frontline healthcare workers, but it's going to take a while to get it out throughout the community to a point where we can actually feel, totally
Yeah.
safe and secure. So we're probably 6 or 8 months away from that point at least.
I'm on the phone with the governor's office every week. They convene a call with all the elected officials, all the town supervisors, et cetera. And they have talked about the plan, and, it's not that simple, getting it out there, and the education process that has to take place. But I think we're going to take a little bit of a break here, and we will discuss the vaccine with Dr. Chris Raio, who, as I said, is the Chief of Emergency Medicine at Good Samaritan Hospital.
You're watching ITV, Channel 18, Islip Television.
Hi, this is Town of Islip Supervisor Angie Carpenter, here with Dr. Chris Raio, the Head of Emergency Medicine at Good Samaritan Hospital, part of Catholic Health Services, and I think you kind of oversee emergency medicine for the system.
I do.
So we've got someone here who's very, very knowledgeable and very, very caring, I've got to say that, and I just can't thank you enough for making the time.
Of course.
There's a lot happening, a lot of, questions. I mentioned earlier that we're on the phone with the governor's office, and they talk about capacity at the hospitals, and so tell us what's going on at Good Sam.
So over the last 2 to 3 weeks, we're definitely, and it's not just Good Sam, it's really the hospitals across the region we're all in the same boat. We're definitely seeing an influx of cases. It's not nearly what it was, back in March, April, May, et cetera. But we are seeing more COVID cases than what we had been, which I think should give everybody a little bit of pause, take a step back. We need to reset and not really drive the numbers up, particularly during the holidays, as we were talking about. But, the hospitals are prepared. We have now sort of our set processes and procedures to keep everybody safe. And there's definitely capacity to treat more patients, so it's not like we're teetering on being, full. So, I think we're in a good place, but we certainly don't want to test and strain the system like we did earlier this year.
So with the vaccine, imminent, any day now, are there things that are going on via treatment for COVID at the hospital that might be different from the past?
Sure. So, well, first, in terms of the vaccine, we're expecting that we're going to be getting doses as early as this week for frontline workers, which is great. We're definitely better now at treating these cases, particularly the critically ill patients. But even for outpatient therapy, There's antibody treatment that we've been giving for the past now probably 10 to 12 days that we're seeing very, very good results. We're seeing patients getting better faster. We don't have any published data, to say
Right.
for certain that these things are working, but from the patients that we're following up with, it seems to be a very successful
So-
treatment, which is exciting.
What would be the criteria for deciding whether or not a patient qualifies, or that's a good protocol for, using on that
Yeah,
particular patient?
so it's mostly for outpatients, so it's not for patients who are coming and being hospitalized unless they're being hospitalized for things other than COVID. And then there are criteria based on age and comorbidities, et cetera. So it's not, really for like a young, healthy 20-year-old, but if you're older or have comorbidities, you could be eligible. What I would recommend is contacting your primary care physician, because a lot of this care is being coordinated with the primary care doctors, and they'll then contact the emergency department or the hospital infectious disease team. We'll bring the patients into the ER and treat them, and then they can go home that same day.
So I would imagine that, Good Sam and your team is getting that word out to the primary care
Yes,
physicians
of
to
course.
let them know, that this new protocol, because, 10 to 12 days that you're just doing this is new,
Yeah, we've communicated with all of our, health system physicians, and we're spreading the word as best we can.
And you were helping today, because anyone listening or watching this, broadcast should know that this is available now.
Yes.
And should be asking their primary care. And I know here at the town, if someone suspects that they might, have been exposed,
Right.
that, we have a definite protocol that we're following, but above all, to contact your primary care physician and let them know what the situation is. And,
Absolutely.
Make your decisions in tandem with the professionals.
Yeah, and I think, that the antibody therapy, that's a tool, right? Now we're going to have the vaccine, that's going to be another tool, so we're slowly sort of building up the arsenal, and, hopefully we'll have this thing gone by the end of the year.
Like with anything, I think there's no silver bullet for this.
Correct.
Like you're saying, it's part of a strategy. You've got now the antibody therapy, you've got the vaccine that's on the horizon, but then again, you don't have to get it if you're following the rules,
Right.
Obviously, sometimes you're going to be in a situation that you just had no idea that you were put in, but the washing the hands and, wearing the mask and keeping that I just took this off, but generally it's hanging, from my ears if
Yeah.
I'm at my desk, and the minute someone comes in or I get up from my desk, the mask goes on. And, I've been trying to be so very careful,
Yeah, some people, might be contracting it just through, like you said, bad luck, but, those things, mask wearing, social distancing, hygiene, if we practice that, we've shown that we'll get the numbers way down, so we just need to continue doing that.
Well, overall, as a state, I know the governor is fond of saying that all the time, that, the residents of the state of New York, particularly here on Long Island, have done a really, really good job. When you
Yeah.
think of the vast population numbers, we're at 3 million between Nassau and Suffolk County. That's a lot of people, a lot of interactions, a lot of, opportunities to be in a position that you could be exposed.
Yeah, I think if you look at where we were at to where we are now, people have done a great job, and we have to keep pushing to get through this.
Well, I can't thank Good Samaritan enough, and we are so very lucky here in the town of Islip that we have two,
Yes.
hospitals that are, just well-known for the level of care that they service now. South Shore University Hospital,
Right.
In Bay Shore, part of the Northwell system, and of course, Good Samaritan Hospital, that's been around over 50-plus years, serving the community and doing so in a very, very caring way. And, along with that, Good Samaritan is running the testing site for us in the town of Islip over in Brentwood, which is a community that has been extraordinarily hard hit. The numbers just absolutely, blow your mind when you see the number of cases, the number of cases per 1,000. And when I looked this morning, it was close to 95 per 1,000
Right.
in the hamlet of Brentwood.
Yeah, the rates there are very high, so I think that strategically that was a great site. And
Yeah.
also, I think having the testing site there will hopefully improve the communication and education into the community, which is ultimately what we need to do.
Yeah, and that was part of the strategy. I'm glad that you mentioned it. You know, it's not just a matter of people driving through and getting the test, but getting the information, what to do if you suspect that you may have it, and you've got to quarantine. You can't, you know, put yourself in a position of exposing others, because we're never going to get through it. If, you know, we keep passing it on, you know, it isn't something we want to pass on.
Right.
You know, but the testing site there is open Monday, Wednesday, and Friday, and the number to call is 376-4444 to book an appointment, so you don't have to wait, you're in your car, so it's very, very safe. You're not waiting online, you
Right.
know, next to someone who's coughing, thick in the
Yeah,
head.
yeah, it's
You
a
know,
quick
which-
and
which-
safe process.
You know, we pass some of these urgent care centers, some of them do it better than others, but
Yeah.
when I see people lined up next to one another
Yeah.
outside around the block, I'm like, something's not right here,
Correct.
you know, so, and again, I have to thank Good Sam, because it wasn't a big deal, you know, when we were looking for someone to partner, they immediately stepped up.
Yeah.
Within a matter of a week and a half, the town, we have a tent, we were able to put the tent up,
Yeah.
and get it off the ground.
And I think
immediately.
that shows you that we're in a different place now than at the beginning of the year, also with testing. You know, earlier on in the year, we even struggled with testing within the hospital for patients who weren't going to be staying overnight and,
Yep.
and admitted to the hospital. Some patients we couldn't test if they were going home.
Right.
We're in a very different place today. You know, we have access to testing with results that come back much quicker, and I think that that's also helping to control the spread.
Yeah. So, again, I want to just give you that phone number. It's 631-376-4444. The testing is free. It's on Second Avenue in Brentwood, at the site of the town's recreation center, right behind the senior center. And again, it's Monday, Wednesday, Friday, 1 to 5. And in that short period of time, they're booking about 65 appointments a day. And I urge you to, you know, call and make that appointment. Again, we want to, you know, get people tested, but again, in a safe environment. We're going to take a little bit of a break, and we will be back with Dr. Chris Raio here on Supervisor Spotlight.
You are watching ITV, Channel 18, Islip Television.
Welcome back to Supervisor Spotlight. I'm Angie Carpenter, Town of Islip Supervisor. Again, I can't say thank you enough to Dr. Chris Raio, who's the emergency medicine guru for Catholic Health Services, and he calls Good Samaritan Hospital home. And but I think this has kind of become your home away from home, so we thank you for that. You know, back when this, you know, we really got into the throes of this back in March, and here we are, December. Chris and his team came and we did a panel discussion about the pandemic and what it could possibly mean. And who would have thought in March that we would still be talking about it and living it every day, you know, here in December.
I remember seeing on the news, you know, the cases that were in China, and
Yeah,
it was
yeah.
kind of not really affecting us, and I don't think any of us could have predicted that we'd be here today.
No, but we are, and we're dealing with it, and I think doing so in a very professional, caring kind of way. The vaccine's here. I know deliveries have arrived at some of the locations they're coming to CHS to Good Sam. So I don't mean to put you on the spot, but what are you going to do? Are you taking the vaccine?
I'm going to get it
Are you
as soon
mandated?
as
How do you
I
feel about it?
Yeah, I mean, I don't know that you can mandate, you know, something like this, but I'm getting it the second that I can get it. I've actually put myself on the list that multiple hospitals that I work with to see who's going to get it first. And you know, there's any vaccine, there's some risk. You can have an allergic reaction, but I mean, you can have an allergic reaction to any medication, any food, etc.
Well, if you doubt that, all you have to do is read the directions that come with the prescription now.
Correct.
I mean, I think
Yeah.
if you do, you probably don't want to take whatever it is the doctor's told you should be taking
Yeah.
when you read what the side effects could
Yeah.
be, but.
And I mean, the process, I think people are nervous maybe because the process was quicker than most vaccines, but the process was not unlike other vaccine development, and, it's approved, by our highest, bodies, and, I think, I'm confident that it's safe. And I think it's important that when people have access to it, that they actually receive the vaccine.
Well, I'm really glad you said that, because there are these conspiracy theories out there, and I don't know if I should take it, and, whatever. But if we don't do this, if we don't try to stem the tide, we're just not headed in a really good place.
Yeah, and I think the other really big point is I hear from, young, healthy individuals that, they're not as concerned about getting sick because they think they're going to do well, etc. I think it's important for people to understand that the purpose of vaccinations is not only to protect yourself, but it's to protect the spread.
Right.
So, we need a core number of people to get vaccinated so that it doesn't spread to those people who are at risk.
So that's the herd immunity that
Exactly.
we keep hearing that term, so that you need like 60 to 70%
Right.
of the population to be immunized to really,
Correct.
stop the spread.
And it's not just about protecting you, who you might be, well and, have, a very minor illness. It's about protecting the spread and getting, the entire nation past this pandemic.
Yeah, and those that you're going to be interacting with that have those morbidities that
Right.
you may not even be aware of, but some of the things as simple as, people who are overweight, or
Right.
someone who has diabetes, and we know how prevalent a disease that is,
Yep.
heart conditions,
Hypertension.
hypertension, how many people have high blood pressure? You don't even think about it.
Yeah.
That would be something that would make you more susceptible. So it is so important, and I just can't thank you enough for sharing that, and I
Sure.
apologize if I was a little too personal.
No.
But we really need to get that message out. It is so, so very important. And this vaccine, unlike a lot of others, is a two-step process, so that you have to commit. You don't want to waste that first dose,
Yep.
because numbers I'm sure are limited. And, it's not available to everybody immediately. So if you are one of them taking it, make that commitment to doing what you're,
Yeah, and I
need
think
to do.
that is going to make the rollout a little more complicated, but we have to get the process down and get as many people vaccinated as we can.
And we have someone that helps make this happen, Gary, who's our camera person, and he asked a question during the break, so I'm going to put it out there
Sure.
for you.
And it was a good question,
Yeah,
too.
but very good question. So if someone gets that immunization, they get the shot, are they safe? Can they drop their mask and go off on their merry little way, living life the way they lived it before?
Yeah, so, it's a good question because I don't really know the absolute answer. I don't think so. I think people are still going to have to be safe, still wear masks, and we won't really know for sure that we can sort of drop the guard down probably for, quite a long time, on the scale of months. So I don't think it's going to be you get the shot and you just drop everything and walk out the door and go back to the quote-unquote old life that you had.
I certainly don't know this, I'm not a medical professional, but I can't imagine that you get the shot and you're immediately immunized or safe or don't have to worry. It must take time
Right.
to get through your system and be effective. Do we have any data yet that speaks to that?
So it's certainly not an immediate thing, and particularly in that time frame before you get the second, I think you absolutely need to be cautious.
Right.
But even after that second dose, again, I don't think we really know enough to say that you can stop wearing a mask. And by the way, the hand hygiene and stuff is a good idea for,
Oh, it's not, it can't ever
for
go
everything.
away.
Right,
It
so
can't ever go away.
that should never stop.
Yeah. And as I can attest to the fact that my skin is practically raw from sanitizer and washing my hands, but it's what you need to do. It's a small price to pay to be safe.
Yeah, absolutely.
With the vaccine, and I thought of it and it just went out of my head, but in addition to being safe, what about those who have had COVID? Are they being recommended to be vaccinated?
So, yeah, so what I'm reading and hearing is that those people still may get the vaccine, which I think is sort of counterintuitive to what people are thinking, but I don't think it's set in stone, but I think
So
some of the
perhaps-
recommendations are that they're gonna get the vaccine as well.
So a person who's had COVID, from what I understand, has the antibodies and can be tested for those antibodies. So perhaps that would be the requirement before they would get a vaccine, if they still have whatever the number is, and I don't know, but whatever it is, that they would be considered safe. If it drops, then perhaps they'd be a candidate to be vaccinated.
Yeah, so I think logically that would make sense. I don't know that it's fully set in stone how that's gonna be dealt with. You know, some of the antibody testing, you know, there's certain tests that are more accurate than others. We're also seeing patients who have had COVID have the antibodies, and then they get tested again at a time frame later, and now that those tests are showing up negative. What does that mean? Does it mean that they're not, you know, that they wouldn't be immune? I don't think anybody is even sure on that.
And also too, with the fact that people who were asymptomatic could still spread it.
Right.
Couldn't someone who has had COVID still, you know, be the one that passes it on to somebody else?
Again, no documented case of somebody who had it, getting it again, and then passing it on.
Or not even just getting it, but having the germ on them or whatever, and interact with someone else and pass it on unknowingly.
Yeah, possible, but you know, I think this is one of the reasons why managing this whole pandemic is so difficult.
There's still so much unknown.
There's unknowns, there's time frames where we don't know, so, you know, I test you today, you're negative, you know, you could turn positive by tonight, you know, and.
You know, or go out and touch something
Yeah,
that
there's
is
only,
infected.
there's only so much testing that you can do, you know, even for people who are businesses trying to stay open. I mean, you're not gonna get tested twice a day.
Okay, so then the takeaway from all of this that I get is that regardless, you wear your mask,
Yep,
you wash your hands, and you keep 6 feet apart.
yeah. And I think
As sad as
in
it
places
is.
that are doing that, we're seeing really good results. Case in point, the hospital, right? So
Yeah.
we're all wearing masks, we're social distancing as much as
Okay.
possible, washing our hands in and out, and most of us, if not all of us, you know, we don't know the few
Yeah.
positive cases where they got it, you know, we're
Well,
healthy.
Chris, I can't thank you enough. We're gonna wind up here, and I just wanna wish you and all your family an absolute
Thank you.
wonderful, healthy, you know, we say that, oh, have a healthy, this year it really means something.
Yep.
You know, a blessed and happy, merry holiday, but above all, healthy. And just to remind everybody that we are in this together, just 6 feet apart. Thank you so much.